Meeting to order.
Yep.
Okay, we're going to call the meeting to order. Thanks everyone for showing up tonight, and it's hot. Be aware, RMB Council meetings are live streamed to facebook.com/Belfast PEI. Live stream comments are not monitored in real time during the council meeting. In the spirit of reconciliation, we acknowledge that the land upon which our organization stands is unceded Mi'kmaq territory. Epiquick is the Mi'kmaqi and is covered by the historic treaties of peace and friendship. We pay our respects to the indigenous Mi'kmaq people who have occupied this land for over 12,000 years, past, present, and future. Do any members of council have conflict of interest with any items on today's agenda? May I have a mover? No. Any other suggested agenda items for today's agenda? Yes, Catherine.
So I'm going to acknowledge Pride Month, and then I also, you can just write down Poly Park.
I have an additional item, Musicabilia.
Okay, anything else? May I have a mover and a seconder
I'll move.
to adopt the minutes of the agenda as presented? Moved by Charlie.
I'll second.
Second by Lynn. All in favor?
Aye.
Nays? Motion carried. RCMP report for the month of May has been distributed at the meeting. Staff Sergeant Robinson
He is not here, so I can present for that.
Okay, if you wish.
Thank you. So, Staff Sergeant Robinson contacted me today to let me know that he had an emergency he had to attend to and wouldn't be able to make it. He sends his regrets. Not much has changed from our last report from April to May. We are up just a few calls, but not still we're doing very well considering that we are the second largest municipality on the island, and we have one of the lowest incident rates. So we're doing really well, and keep up the good work, everybody.
Yes.
That's it for me. You have a copy of the report, which will also be posted on the website.
Okay, we have a guest speaker from the Rural Outreach Project, Peers Alliance, and to discuss the previously planned location of harm reduction bus at the Belfast Rec Centre and the appropriateness or need for such a service in the RMB municipality. Please note, no questions will be addressed from the public during this presentation. However, if any comments the public would like to make on this item can be addressed during the next agenda item in public presentations. Questions will be accepted from council. Okay,
Go ahead.
go ahead.
Thanks so
Peers
much.
Alliance, welcome.
Yes, thanks for having us. My name is Ajal Raj. I'm Program Director with Peers Alliance. Prevent, educate, empower, respect, and support. We are the organizational evolution of AIDS PEI, which was the only AIDS service organization to operate in the province of Prince Edward Island.
And I am Tessa Rogers. I'm a project manager with the organization. And thanks for having us today.
Thanks so much. So as we already heard, we live, work, and play on the traditional and unceded territory of the Mi'kmaq people. This territory remains unceded, and the indigenous people of this land have never surrendered their rights to the lands and resources they have traditionally used and cared for.
So we have a few objectives for this evening. One, we're hoping we can define what harm reduction outreach is. we're hoping to provide a summary of Peers Alliance harm reduction initiatives, describe outcomes and learnings from peer-led rural outreach project that's already occurred, and provide overview of current rural outreach project.
And I should say we are a smaller group, so depending on time allocations and what council feels is best, if there are questions from the floor, we can respond to those in real time. So happy to have more of a conversation, recognizing that we are a bit of a smaller group.
And also wanting to respect whatever
Regulations
regulations
that you folks
council
have in place,
has.
yes. But we do, it is about information sharing, and we do want to be respectful and responsive to what community members have on their mind. So just a little bit on harm reduction outreach, as is the case in most interventions that fall underneath the harm reduction umbrella. We're building on peer-to-peer outreach efforts. But over the last decade, there has been attempts to really professionalize what would be considered street-level outreach services. So effective outreach reaches people who might not otherwise seek support through mainstream services, whether that's clinical health services, housing services, and other social support agencies. It engages people who are experiencing barriers or challenges to existing supports that are available in community, and it is one way to ensure that people's most basic needs are met while supporting them through a stabilization process. Key objectives for rural outreach include supporting and maintaining professional relationships with at-risk community members, providing unconditional material support to prevent death, disease, injury, and otherwise promote health and wellness, to connect participants to external services that are more adapt to meet needs, and to continue to adjust and adapt various project activities in ways that meet changing needs in communities that outreach is occurring in.
Yeah, and I think one thing that's really important to note is harm reduction outreach is really structured to meet people where they're at, both circumstantially and in their location, so that way we can offer supports. So our harm reduction approach is really acknowledging that people engage in risky behavior, and we can find ways to reduce the risk associated with behavior. We understand that at any given time, there will be people who either can't, don't want to, or don't have the ability to focus on sobriety. So how do we keep them alive and making the most informed decisions for their body as possible? We acknowledge that there's wait times in treatment services. There's also, it doesn't always work for everybody. Harm reduction is one tool in the tool bag, so it exists in tandem with treatment and prevention. It's not the golden bullet by any means. It's trying to connect all of those things.
Yeah, so it is acknowledging that high-risk behaviors occur in our communities, in our societies, and that it relates to several things, whether it's driving, whether it's sexual activity. Substance use is occurring across Prince Edward Island, and again, harm reduction is one way to meet a particular need for a particular population of people. But we are actively trying to combat the false belief that harm reduction works in opposition to recovery-oriented or treatment-oriented services. So harm reduction staff or outreach staff that work for Peers Alliance are also able to complete formal referrals into treatment services, support people in accessing detox services, and in a lot of cases provide transportation to folks who are seeking to access those services. So just a kind of overview of our current harm reduction initiatives. So most recently, we've opened an urgent public health needs site in Charlottetown that will allow us to offer more comprehensive and robust drug checking services, targeted engagement activities, and educational programming. This builds on street outreach efforts that have been happening in Charlottetown since 2020, with core pillars of bridging gaps to case management, to creating links to coordinated access, or HIFIS, the Homeless Individuals and Family Information System, and providing, again, that most basic needs support. So in addition to harm reduction supplies, water, foodstuffs, emergency blankets, sleeping bags, and other materials that folks need in order to stay alive, basically. And more recently, we've expanded beyond Charlottetown with outreach efforts through rural activities. So the project that we'll be speaking on this evening builds on peer-led efforts that were launched in 2022. This iteration of rural outreach will focus on directly connecting participants to outreach staff, and it will focus on identification and engagement. So as we'll hear today, previous iterations of the Rural Outreach Project really focused on peer-to-peer support, which was fantastic learning, but we still don't have a clear or comprehensive understanding about what folks need who are consuming street source or currently criminalized substances in rural communities, and that's what we're going to be focusing on this year through the Rural Outreach Project.
So this is a lovely map put together of some of those areas that were already engaged during the evolution, I guess, of our peer-led rural outreach project. So the objective of this was to reduce incidents of drug-related harms amongst community members who consume street source substances in rural and small town communities. So it was delivered from 2022 to 2024. In this time, 7 peer leaders were trained, 5 of whom went to deliver peer-to-peer outreach activities in rural and small areas. Over the course of the project, peer leaders engaged with approximately 200 unique participants or individuals in 29 different communities that did include Belfast, Wood Islands, and Murray Harbor. So in utilizing a peer-led outreach model, the team of 5 peer leaders delivered 6 core harm reduction activities in rural communities. They provided safer use information and education, so overdose response services. They distributed injection naloxone kits and gave education on proper use of those life-saving tools, distributed harm reduction and safer use supplies, including injection equipment, collected use supplies with a focus on recovering injection equipment for proper disposal, distributed fentanyl test strips for drug checking with information on proper use so folks could check their drugs, and disseminated toxic batch information within their networks, which was super crucial. We did have a number of clusters of overdoses in the island, and this was actually how we disseminated that message to folks so they could make informed decisions. A peer team coordinator provided ongoing staff to peer leaders and was able to provide navigations and referral supports to participants accessing those peer leaders. So this would be those housing programs in Montreal-Skoka. This would be any healthcare needs that they had, mental health and addictions connections, and socially isolated participants who consume substances alone kind of work with those individuals to identify any risky behaviors.
Which is a risk factor that we see more commonly in rural communities, and an unfortunate reality is that overdose instances in rural communities are more likely to result in fatalities because this is often behavior that folks are keeping super secret, often things happening behind closed doors or behind locked bathroom doors where nobody is able to respond. Which brings us to overdose risks in rural communities. So we were able to do both pre and post participation surveys with community members who are accessing rural outreach services through peer leads. In post-participation surveys, 44 respondents, or 59%, indicated that they had witnessed or observed an accidental drug poisoning at some point over the last 12 months. 31% reported administering naloxone themselves at some point over the last 12 months, and 23% reported experiencing an accidental drug poisoning themselves at some point over the last 12 months. In the post-participation survey, the vast majority of respondents, 94%, reported that the peer-led rural outreach project had increased their access to overdose prevention tools such as naloxone and drug tracking strips. All island communities are being impacted by the toxic drug supply crisis, on top of a healthcare crisis and a housing crisis. This is certainly not just a Charlottetown issue, and why we are continuing to focus on rural outreach.
So some encouraging findings from the peer-led rural outreach project, again, which ran from 2022 to 2024 and had that survey. 95% of those asked, so 70 out of 74, reported improved access to naloxone through the rural outreach project, and 86% of respondents reported feeling comfortable and confident in administering naloxone, so that can save a life in the event of an overdose, and 61% reported that they carry naloxone with them on a regular basis now.
And this is huge because we know through work with the health authority and through work with Island EMS that it is primarily community members, folks who are active in the scene, for lack of a better word, who are most often responding to instances of overdose in Prince Edward Island. It is the fact that community members are willing to carry naloxone and get trained on how to use naloxone that we're not seeing the same level of fatalities that unfortunately we are seeing in other maritime provinces. So if we look at the second bullet point, 82% of surveyed participants reported that they had adopted healthy behaviors through the project participation, and some reported even changing consumption practices through project participation in ways that would increase health and well-being. Participants who reported that they had actively changed behavior through participation were then prompted to provide more specific details on what that meant. So some of the examples provided were that folks stopped reusing personal consumption equipment. So we heard a lot of horror stories of folks like saving a single syringe, using it multiple times, trying to sharpen it on objects, which has a whole host of risks for infection and other issues. Some folks reported that they had started using new or sterile consumption equipment every time. Participants reported that they started using proper sharps disposal practices, and a lot of that was related to the ability to quickly access actual sharps containers and then being connected to a service that would help collect and get rid of that waste. Participants reported that they had started using drug checking technologies regularly. Some reported that they had stopped sharing consumption equipment, which is again super important when we talk about HIV and hepatitis C risks. A lot reported they had started carrying naloxone regularly, and then 3 participants who had reported that they were able to switch from injecting substances to smoking substances because they were able to access the smoking material regularly.
So 62% of surveyed participants reported the awareness of technology, and 7% reported using remote overdose prevention services at least once. This is massive. As Angel said, folks that are living in rural areas are more likely to experience a fatality if they experience an overdose. So this is actually a remote way that folks were able to get that support in case anything did happen, that somebody could intervene in an anonymous way. Prior to the launch of the Rural Outreach Project, there were no calls to the National Overdose Response Service. Over 2023, there were 27 calls to the National Overdose Response Service from PEI, and in 2024, there were 22 calls to the National Overdose Response Service from PEI in January alone.
I think that's one of my favorite findings. In COVID, one of the things that we tried to pivot to was offering some sort of remote overdose prevention service. We ended up being crippled by insurance issues, and in sort of the context of that happening, the national service launched. So the fact that we're actually seeing uptake, particularly in rural communities locally, is huge.
Can you provide a little bit more details on what is like the remote prevention, what that is?
Yep.
So it's a national service. It's 24/7. It's free. It's peer-led, meaning that everybody who answers that phone or is on the other line of that phone app is somebody with either lived or living experience of substance use, whatever that looks like to them. So a lot of folks report that they feel a lot more comfortable with that. So essentially what it is you can either have the phone number or you can go on an app, and what you do, it's anonymized, and you and that operator of that phone line work through a safety plan of what it looks like if you become unresponsive at any time. So you get to decide what that looks like. So like if I called, I might say, hey, you know what, call my friend Angel, this is her phone number. Or if I go down, call 911 emergency, here's my address.
So basically they would be kind of like on the phone or like with somebody while they use the drug. Gotcha.
Yeah,
Yes,
it's remote observed consumption,
Okay.
basically. And the 2 options are important because the NORS phone line allows folks with phone service to make a connection, whereas the Brave app, you don't need a phone plan or phone minutes. As long as you're connected to Wi-Fi, you're able to use that service. So engagement in Belfast. So over the peer-led project, those peer leaders logged over 4,000 interactions with community members island-wide. Belfast was identified as an underserved area through the Rural Outreach Project. Although we did not have a peer lead residing in your area, harm reduction outreach activities were still logged in the community of Belfast. meaning that folks, at least one peer leader, traveled outside of their own community to provide that peer-based support. And again, as Tessa already suggested, that included providing harm reduction material, including consumption equipment, naloxone and drug checking strips, as well as sharp boxes. It included sharing and distributing harm reduction information, so that might have been like North Brave tutorials, and collecting used consumption equipment from participants for proper disposal. In publicly promoting an outreach access point in Belfast, Peers Alliance hope to let community members who may be struggling and in need of support know that staff will be regularly available in their area. So one of the downfalls of the peer-led project is that peers had discretionary decision making in terms of what their network looked like. So although most peer leads kept fairly open networks and were open to referrals coming from other community members who may have been accessing them for the service, you had to be in the know to get that connection. So this is more about creating equity in access. We want folks to know that we will regularly be around and that we want to hear from them. We want to know what needs are in Kings County so that we're better able to plan projects. Sorry.
You're starting Queens.
Sorry, Queens County. Queens County. Information collected through post-participation surveys highlights the importance of facilitating access to harm reduction services in Queens County. What we often heard from folks is that high risk behaviors were often happening out of perceived necessity. So again, folks did not have access to smoking equipment often. They weren't aware that these materials were available. They're not available at provincial needle exchange at this point. Folks were not aware of NORS or Brave, and we found that folks were often hoarding isn't the right word, but hanging on to consumption equipment longer than they needed to because returning for proper disposal was a bit of a challenge. So being able to actually work with the community members that we're providing equipment to make sure that that equipment is recovered was an important finding of the project and one that we hope to build on through this iteration of the Rural Outreach Project. I guess the last point is that what we found was that in comparison to peers in Charlottetown, rural outreach participants were less likely to be connected to other services. So where a lot of the folks that we're working with in Charlottetown core are connected with case managers that we're able to kind of coordinate supports with, in rural communities we found that often wasn't the case. They weren't connected to any other service providers.
And to say, like, a lot of the time, those individuals who weren't necessarily connected to services didn't have someone following them along. So even if we talk about somebody who is pretty new to sobriety and they're on methadone as an alternative, a lot of the time they didn't have somebody to remind them, like, hey, your methadone appointment is coming up. Can you make it? So then they were starting to miss those appointments. And again, like Angel said, the hanging on of used equipment was huge. That was a large thing that we saw in those rural areas because people didn't, like, either couldn't make it to the needle exchange because they didn't have transportation, they were feared of stigma, or the hours of the needle exchange program did not work for their schedule because it is limited in those hours.
And we know, like, perceptions of community surveillance and not wanting to be outed as a consumer is another huge barrier for folks who are struggling with substance use disorder in rural communities. And so that's another barrier to accessing those more formalized supports like the provincial needle exchange program.
So through ongoing program development, we are seeking to enhance rural outreach services by increasing direct access to Peers Alliance outreach staff in rural settings. So in activity planning for this version of outreach, we were aware that our drive stop route would continuously shift based on community needs and desires and feedback. There were attempts to identify safe and public meeting spaces in several rural areas and in underserved communities by earlier peer-led rural outreach project that we were speaking of. Although we're no longer prompting scheduled stops in specific locations, outreach staff will continue to travel west from Charlottetown on Mondays and east from Charlottetown on Thursdays. At the present time, community members seeking these services can call, text, email, or reach out over social media to connect with our rural outreach team. In addition to distributing safer consumption equipment and other harm reduction resources like naloxone, peer staff can facilitate access to other supports and services by creating linkages with services like HIFIS, as Michelle said, that provincial database that is used for homeless individuals and families as an information system, coordinated access to clinical and medical care, and supporting connections to mental health and addictions services.
that is the end of our presentation, but as I said, we're happy to answer questions or otherwise engage in conversation. Yes?
I need you to educate me a little bit. Because I'm obviously not familiar with the drug community. What kind of drugs are you talking about that are prevalent on Prince Island? People are injecting or taking their causing all this grief.
So I think, Prince Edward Island, like many other places in Canada, you can find what you are looking for. Primary of concern right now would be fentanyl analogs, and crystal methamphetamine. So we are seeing a huge influx of synthetic substances, and these things are these product that's being produced is essentially like a toxic soup of various chemicals that are then purchased and sold as under different names. So for example, prior to in West, you would have heard of heroin a lot before fentanyl. In Prince Edward Island, I think we were really buffered from the opioid overdose crisis because what was available through street source purchase was often pharmaceutical grade opioids. So in 2019 and 2020 even, a lot of folks were consuming like morphine, Dilaudid, hydromorphs, those type of substances. And then in the context of COVID and post-COVID, we saw an influx of fentanyl. And so for folks who weren't interested in taking fentanyl, the supply eventually became so saturated that it's pretty much the only opioid down available through street source methods. Similarly, I would say, at least through our organizational work, we weren't seeing crystal methamphetamine like we're seeing now. Often we were hearing about speed, which could have been any kind of concoction of amphetamine, and was often sold in a powder and not quite as potent, where now we see the crystal methamphetamine in the actual crystal form. So certainly local supply has changed significantly, and it is that toxicity level that is so concerning. So we see not just fentanyl, but now we're seeing additional substances being added to fentanyl, xylazine, animal tranquilizers, and those have different effects. So you're talking about more complicated overdoses. You're also talking about other drug-related harms such as complex wounds, because human bodies just aren't made or able to metabolize those kind of substances. And so that has risks in terms of skin infections, folks presenting at the ERs with complicated wounds, and amputations in extreme cases.
So basically, these are all illegal drugs.
Not all of them. So some.
Which ones aren't?
So
Jim?
Please give a list.
Sorry, I just have to interrupt for 1 second. I'm getting a note that they can't hear you properly on the Facebook live stream. Sorry. Just move this back just a little bit.
Yeah, so for your question, a lot of, I wouldn't say a lot, but some of the individuals we work with are actually using their prescriptions, and they're using their prescription in ways that weren't prescribed. So they're able to legally get those and obtain those. However, their prescription says to take them orally, and they are smoking it or injecting it in different modes of consumption. A lot, like as Angel said, sometimes those prescriptions do change hands. People might be prescribed something and they might sell it to buy something else. So there are illicit street source substances, absolutely. And there's also the pharmaceutical grade stuff that we are seeing. So it is really complicated, because when folks are buying stuff on the street, where like Angel said, 5-10 years ago, if someone sold you their prescription Dilaudid, chances are it was their prescription Dilaudid, where now it could be a pressed pill that has fentanyl in it and also has this coarse grade tranquilizer causing you to overdose.
Sorry, Jim, can you speak up a little bit?
I'm a soft-spoken person.
I know. I've got the mic right there, but I'm just.
So basically what we're talking about is the consumption of illegal drugs that are defined under criminal code. That these people are taking an illegal substance that is not allowed in Canada.
Yeah, so again, like Tessa said, it's somewhat complicated when we get into pharmaceutical grade substances that are diverted into illicit markets. But when you're talking about fentanyl, that is not pharmaceutical grade, when you're talking about crystal methamphetamine, yes, we are talking about.
So when we're talking about young people, do you think the message they're hearing is that it's safe to do drugs?
I think if it was safe
Because
to
you're
do,
making it safe.
Yeah,
I
no,
don't think so, because there's still, like, part of that harm reduction messages isn't just dismissing the risk. We are still, it is our job and duty to still tell people that you can have infection, you can overdose, you can die, you can have adverse effects, this can affect your cognitive ability. So a lot of the individuals that we are working with are already consuming substances, and we're helping to make healthier decisions. I know when I was a student in school, they had a DARE program. It was don't drink alcohol. What did we do when we were kids? A lot of us went to field parties and drank alcohol. So I think like people are people consume substances regardless, and we want to give them all the information and all of the safer use messages that they can make those informed decisions.
and I think what's super important is that we're not the only tool in the toolbox. And so it is important to note that harm reduction services are for a particular group of folks. They're for folks who are actively consuming street source, currently criminalized substances, and often folks who are the most marginalized in doing so. So the folks that we're working through outreach services are often also struggling with other issues, whether it's housing insecurity or mental health issues. We still need prevention, and we still need treatment, and we still need enforcement.
A lot of
I
people.
read in some of your material that you said that the idea is that people are going to use drugs anyway, so we will show them how to do it in a safe manner, and we'll supply them with the equipment to do it. So would you not say that that makes peer to be an enabler, promoter, and a participant in the illegal act?
So I would say that if we
I would.
narrow down the definition to enabling to its bare basic bones, we are enabling people in making healthy decisions, making more informed choices, and taking autonomy of their health. We are not providing the drugs to them. We are not.
Or are you not providing the means to take the drugs?
I think, yeah, so what we found through the Rural Outreach Peer-Led Project, again, right, is that the consumption behavior happens whether we're providing the service or not. And so when you take away the harm reduction service, you don't actually take away the consumption. The consumption is just more high risk. Because, like, for example, prior to the expansion of the needle exchange program, like 2019 to 2022, maybe, my dates might be wrong, we were experiencing a fairly rapid increase in hepatitis C numbers, and that was directly attributed to injection drug use. For a while, we were making gains in like having the most hepatitis C burden across the country, and that was primarily impacting young folks. So when you think about healthcare impacts of chronic infection, that's a serious issue. And so providing sterile equipment to somebody who's going to be consuming those substances anyway is a way to make, to address that particular issue. At the individual level, it means that the person isn't getting ill, and at the community or health systems level, it means you're not treating that chronic infection.
I think it's sort of symptomatic of one of the sicknesses in our society today is that we seem to spend an awful lot of time trying to get away from what we call natural consequences. And we all know that as adults that you pay the price for decisions that you make along the way. I'm particularly concerned, again, like I said, that I'm concerned that the message you're really giving to young people, because that's what the 16 to 17-year-old mind is hearing. You can do drugs in a safe manner.
So
Yeah, and I think if a 16 or 17-year-old person came into the office and went through some of our literature or
They're not really
went
obvious.
on our website, they would find a lot of information that communicated just how high risk substance use is today because of the presence of substances like fentanyl. We're not shying away from that. Again, our services are targeted not necessarily at that 17-year-old person who may be, at early stages of experimentation. Often the folks that we're working with are dealing with some pretty complicated situations and may have been habitually using substances to self-medicate or deal with other issues for quite an extended period of time. I agree with you. Natural consequences are a thing. We do a lot of work around accountability for folks that we're working with, for sure. And a lot of the sad reality is that a lot of the folks that we're working with have really complex histories of trauma, and unfortunately the substance use is a natural consequence of not being able to provide that early intervention and that early support. And I would agree with you. I think as a society we really need to focus on that particular.
I noticed recently that particularly some of the hotspots in the United States, in Oregon in particular, and we all know what's happened in Portland, and British Columbia, who have moved away from decriminalizing these type of drugs as a kind of social experiment, thinking that by taking away the stigma of it, that it's going to somehow improve things, and they found it's been exactly the opposite. That it's just that if you're in Vancouver on your cruise, you can go to Granville Street or in Victoria around Bastion Square, and you will see the consequences of people that are diseases all over the place. I remember we used to go to a church in Victoria that was absolutely destroyed when they opened up a drug exchange, needle exchange program. You couldn't go within a block of the place.
Yeah, I think, it is important to look at resource allocation and know that there's not one-to-one comparisons. So I know like the policy changes that have been happening in BC, one of the big issues that they had was that folks were actively seeking out hospitals to consume because overdose rates are so prevalent. And so we do have to approach these issues with a certain level of compassion and empathy, recognizing that for a lot of folks, they're just trying to survive the day. They're just trying to get through to tomorrow. And folks who are dead don't have an opportunity to recover. This is really about engaging folks to try and create those connections to support.
I know you're. So what do you think about the Singapore policy?
Let's keep it to Belfast, Jim.
Pardon me?
Let's try and keep it to real for our own community.
I'm asking some questions.
Yeah, about Singapore.
What do you think about the Singapore?
So I think like
the
just
way that they dealt with the problem
so-
there, which is that is one of the best programs in the world.
So I personally, just to respect everybody's time here and like to hear everyone's concerns about Belfast and just what we're doing, I would love to take up this conversation at another point, if that's okay with you, just because I think like we can talk other parts of the world all night long, but I think I want to respect everybody's time and kind of get to what do we think about Belfast and like what do we think about PEI specific, because we are vastly different and we are quite a unique province compared to other places in Canada or the world.
Catherine, you have a
So
question?
that I guess was gonna be my question is what exactly are you planning on doing in Belfast and how do you plan to go with it?
So the plan for the Rural Outreach Project would be the 2-person staff team in an unmarked vehicle. So again, at this point, given our resource constraints, we're talking about 1 day a week where folks would travel west from Charlottetown and 1 day a week where folks travel east from Charlottetown. Folks are operating in an unmarked organizational vehicle, so there's no obvious indication that we are providing the outreach service or that the outreach service is happening out of that vehicle. And then we have the dedicated rural outreach phone line, so folks are able to call and text that number. We also publicly share the lead staff's email address, and folks can reach out on our social media. So although we had been publicly promoting stops just in order to sort of hold space for community members, we're no longer doing that. So folks do need to reach out to a staff in order to coordinate access to the service. And outreach staff will work with community members on a case-to-case basis to identify a safe place for folks to meet, because this is new territory for staff as well as participants, and so we do have to keep everybody safe. So primarily the work will be occurring out of the outreach vehicle, and the services that are offered through our rural outreach services are also listed there. So safer injection equipment as well as sharp boxes, safer smoking equipment, which we will also take back. Naloxone and naloxone training, overdose prevention information and education. So I think, Jim, that gets to some of your questions around education, risk informing. We do a lot of that work. Drug testing services, so we have test strips right now. So for example, folks who are consuming stimulants often request fentanyl test strips because they don't want to accidentally be consuming that powerful opioid in their stimulant supply. We also have benzodiazepine test strips and xylazine test strips, and we'll be launching more robust drug checking services through the Urgent Public Health Lead site, which will use FTIR spectrometer spectrometry.
Yeah, which is a fancy
Technology.
machine that kind of tells you the chemical composition of the breakdown of what is in that sample, so then people can make those informed decisions. I think one thing that's also important is survival equipment. So a lot of the times we'll have folks reach out to us that are just in a tough place, whether they need help being connected to a food bank, whether they need help being connected to a support to pay their power bill so their lights don't go out. Like our staff are able to do those like life-saving efforts and make those connections, as well as if we do have housed community members who are storing their sharps and can't make it to the NEP, our staff can coordinate with them to go to their residence or go to a public location, pick up those used materials from them and dispose of them properly.
And then, as we were saying, like the referrals to health, housing, and other services, we're also hoping to have a more clinical outreach component attached to the rural project, so actually being able to meet folks where they're at to do things like investigate wounds or foot care, or things that we would see commonly, weather-related injuries, so that folks aren't directed into emergency rooms that are struggling right now to keep up. So that's certainly something that, as I said, that we've seen, right, is that although the folks that we're working with in Charlottetown tend to have a little bit of a resource network through other service providers, we're able to collaborate with case managers, for example, in order to develop like individualized support plans. The folks that we're coming into contact with through rural outreach tend not to have that level of connection, and so we really
Awareness of what's around, which is really important.
what resources are available in their own communities. So this year will really be about mapping some of those needs out so that we can effectively plan again, because this work is all relationally based and everything builds on everything else. So what things look like this year is not necessarily what things will look like next year.
What are some of the minimum requirements for your location do you require? Do you need water, running water, hydro type of deal? No.
No, like we can just run through the vehicle wherever we can drive a vehicle. So,
Okay.
Not sidewalks, but just anywhere that we can drive a vehicle, we can really kind of
You just
accommodate
need
those
a
areas.
parking lot.
And then, yeah, absolutely. And then the other concept is that staff safety. So if someone were to call the line, then it would be try to organize a spot that both individuals would feel safe. So maybe not, down a dirt road that
Yes.
no one's around, but just to really prioritize not only our staff safety, but that individual safety as well, because I understand there's a level of autonomy, anonymity. Thank you very much. That's a very hard word to say. That folks often would like to maintain.
Anyone else with questions?
I think just a general comment, some of the things I heard were specific to the location, and I'm sure you guys have already heard this 1,000 times before, but, concerns about that specific location, like not being contacted beforehand.
Yep.
And then I think just, obviously we saw it as a safe spot, but I think there were concerns in the community that, the proximity to children and things like that was a concern.
Yeah.
So those were the biggest comments I heard.
And we totally respect that, and I think definitely some of that is on us, and we've reached out to apologize. I think as you mentioned, in planning those locations, it was really like, is there a safe spot where folks can gather? We did think like the duration of 15 minutes and the time being during the day would not disrupt the operation at the rink. And we were also aware that next week it might not be the same location if we got calls that were Murray Harbor, for example. So
It was
that's
really
on
like
us.
a launching
And
point to make that route around. So even if folks called us up for 30 minutes and we were allocated to be there 15, well, those 30-minute calls would take those priorities. It was kind of like, this is the general area that staff could be expected in.
Yeah, it's just we understand that awareness of the service is still very low, even with the peer-led project, and so just trying to get information disseminated again that this is something that will be regularly available in communities. But we totally appreciate that community felt like that was not a suitable location, and I think right now launching the service or starting off with sort of like a warming phase of where folks will reach out individually is a starting point that we can manage. Ideally, we would like to work with municipalities to find a suitable standing location that we can publicly promote. We do know that folks struggle with phone and internet access, and so reaching out over those needs to pre-book with staff is sometimes not possible. But we do have to start somewhere, and we recognize that this is where we're starting today.
So this is kind of like a new kind of initiative for you guys to kind of take it to the next level. I would just be kind of curious as to, where people have a lot of concern about maybe being outed and stuff like that. Do you expect that if you had a regular?
Charlie, I just can't hear
Can you turn around?
Oh, sorry, yeah. Where people might be would expect that if you had a regular location that you plan to be, and it was well communicated to the community, I would just, my thought would be that you probably see less attendance because people in the community who do use drugs, who don't want their community members to know that they use drugs, would be less apt to use that service if it was something that was widely known as the time and place where that takes place.
Yeah, and then like we're really trying to work with those multiple access points, and that was one of the reasons why our vehicle is unmarked. So we did hope that, and like that's why arenas and things were targeted community fridges, because we were hoping to just be another car in the parking lot kind of thing. But again, like we recognize that where we're starting right now is not with posted locations. We hope to get to that some point at someday, and do hope to work with municipalities to identify where that spot will be. And it may be that 6 months, 8 months into the project, we have much more robust data in terms of who's reaching out in this area and where it might make sense to host that initiative.
And I think in part of that too would still be working like with that case by case individual basis to say like, hey, if you don't want to come here, what does that look like for us to drop that off to you? What feasibility is that, and how do we work together to kind of get your needs met while respecting that you want to remain private?
I would
Andy,
prefer if you
question?
stayed in Charlottetown, stayed out of Belfast myself.
I think I understand that and I respect that, and I also think that people in rural areas do deserve access to care and access to services that could save their life. People are using drugs here, so why don't we make that safer and not necessarily a death sentence?
Well, when you use that premise, I suppose you could say that, using that premise, you could say if people are gonna drive drunk, we should be teaching them to drive drunk safely.
Well, I think that's why we have alternatives, right? We have taxis, we have cabs, we have buses, we try to robust that service. We have conversations prior about like, hey, are you drinking tonight? Do you need to drive home? We should take those preventative measures and also those restorative measures afterwards.
And I think continuing to concentrate the services in Charlottetown is just a way to perpetuate health inequity that we keep seeing showing up in more rural communities. So again, more intense drug-related harm because early interventions or tools aren't available.
So I think even a lot of participants I've worked with have started with a script from their doctor, and then they were cut off, or there was no wean-off point. So then they started going to street source substances, and now they're buying their substance from a drug dealer. They don't know what's in it, they can't test it, and they have no access to work with individuals to make those connections, points to care. And that's something I've seen time and time again, even a single mom working three jobs and trying to take care of her children and needing to take a speed pill to stay awake. Like those are also individuals we can work with and help those guys or those gals or people connect to services.
Andy?
Do you have an idea about the demographics of users, say in rural communities, but more specifically in Belfast? So is it 17-year-olds? Is it 57-year-olds?
So it's interesting because what we found with the peer-led project is that demographics typically mirror the peer, which makes sense because we're able to reach folks in that network or folks who are connected to that network. And so I think we still have a lot of work to do in identifying different demographics who may benefit from access to harm reduction services. So it's not a great answer, but based on the information that we have so far, I would say like one of the key things is that the folks that we're reaching in Summerside are far more likely to be unhoused, where folks in rural communities or folks who are engaging with the project, although we did see some housing insecurity and homelessness, were more likely to be sheltered, although sometimes precariously. So that's one demographic shift, but certainly mostly adults and mirror demographics of peer leaders, which tend to be in the ages of 30 to 45. Demographic split in terms of gender split, we did see more men engaged than women, although we had more female identified peer leads. So I think that mirrors what we see across the country in terms of just men being more engaged in harm reduction services than women. And across the board with Peers Alliance, I think because we do so much health promotion work with queer to us LGBT plus communities, we do tend to see those folks more frequently than maybe some other harm reduction initiatives that are operating in Atlantic Canada that don't have that same organizational plan.
Well, thank you, and thank you for such a wonderful presentation. It was
Thank you. Appreciate
Thank you
it.
for coming.
Is there anybody else?
Anyone else?
Who do you, like, I assume there's a government organization you just answer to some extent, right?
We get funded, so primarily we receive, so for example, the peer-led rural outreach project was funded by Health Canada. This iteration of the rural outreach project is funded by Department of Health and Wellness. And we do generate unrestricted revenues through things like workshops, so that helps supplement some of the program costs as well.
So like we're our own entity and receive funding from folks that do get our reportables.
Anyone else? Thank you very much, people from Peer Alliance,
Thank you so much
for your
having us.
presentation
And if
and
there are follow-up
allowing for questions.
Yeah, happy to respond to emails or.
I can post a copy of your presentation on our website if that's okay.
Yeah, absolutely.
All right, so that will be posted tomorrow on the RMB website.
Yeah, and happy to like follow up with those conversations, just again wanting to be respectful of everyone's time. So like if you want to engage in that conversation, you can send us an email and we can set up a time for sure.
Thank you so much, folks. We do appreciate the invitation, and we do apologize for the communication issue that led us here tonight, but I think this is productive conversation, and we do hope to work with rural municipalities on drug response efforts. So thank you again for having us.
Thank you.
Okay.
Item 6.
Um,
Is there any
Okay. Any public presentations to be had tonight?
Nope. Nope.
No. Okay. Adoption of the May 15th, 2024 council meeting minutes. Approved as previously distributed and all changes incorporated. May I have a mover and a seconder to approve the minutes of the May 15th, 2024 council meeting as presented?
I'll approve.
Approved by Billy, seconded by Catherine. All in favor?
Aye.
Nays? Motion carried. Business arising from the May 15th, 2024 council meeting minutes addressed in today's agenda. Is there more to that?
Nope.
Okay. Adoption of the May 22nd, 2024 special council meeting minutes previously attached and distributed, all changes incorporated. May I have a mover and a seconder to approve the minutes of the May 22nd special council meeting as presented?
I know.
Moved by Lynn,
Charlie second.
seconded by Charlie. Thank you. All in favor?
Aye.
Nays? Motion carried. Business arising from the May 22nd, 2024 special council meeting minutes? None.
I need something clarified for me on that. I did get an email, James was asking a little bit on this. So I was going to be taking the role of the social services coordinator.
That's correct.
But then I noticed a thing in the job descriptions, and I was going to update that list. And then I noticed a thing in the duties of the CAO and the staff, and it specifically says that counselors are not allowed to do any kind of work that, if I understood that correctly, that could be done by the administrative staff. Did I read that right?
I'll have to look at it, but there's no way that Bob and I could handle all of the roles and responsibilities of all of the MEM positions. Therefore, we do require the assistance of council to fill those positions. There's just no other way to handle an emergency internally within our office with the staffing that we have currently. There's no way I could wear 10 hats during a crisis. It's
Maybe
just
that
not
should be-
possible.
Well, I was thinking specifically about having to update that list. If that's the case, that should probably be removed from the CAO's duties or from the duties of administrative staff.
Right, so I told you in an email that I had already updated one of the appendixes, and you said that you were going to update the other one. So I thought, great, this is amazing. Jim is going to help update this list as per the roles and responsibilities of that position. If you would not like to do that, I am okay with taking on that role and getting that done. Most of the list is already updated anyway.
Oh, it's not a big job,
No, it's not.
I just noticed that that thing in the, I don't know, administrative duties or something, that the council
Right.
is not allowed to do it.
Yeah, I can look at the language, and
What
we might
document
have
are
to
we
change
referring
that.
to? Is it in the MEMP document?
I think it's in the MEMP. I think it's in part of our
So
plan.
the duties, roles of the CAO.
Yeah,
Probably a lot of that was just cut and paste anyway, was it?
yeah.
From like larger municipalities.
It's traditionally, this is the way it's been
Yeah.
with past councils. The past councils all had roles and responsibilities, that they had to adhere to just to help the community
not-
during a time of crisis.
Was it not recommended by our first EMO meeting officer?
Bryce Doucette or
No,
the other one?
yeah, the other one.
Probably
Dan
Dakota.
was a man, he was
Yeah,
here.
probably Dakota.
And he recommended that the councillors all have a role in the MEP. Is that correct, Andy?
That's right.
We have an ex-councillor executive
Well,
extraordinaire here
We have
on the house.
alumni in the house.
But
Right,
Bryce
Honorable
did
Andy.
as well during the meeting too.
Yes.
Like, that's why he was there.
Yeah, well, yeah, the EMO officer was there, and I'm sure if it was something out of the ordinary to have council in those positions, we would have had that discussion. But that
So it
didn't
just
happen.
sounds like it's a bit of an inconsistency in language that we
Yeah,
can fix.
yeah, so I can do that. Okay, is that all for that? Okay, moving on.
Okay, adoption, we had to,
We did that
did we did
already.
that? Okay,
We're on
that's
number
the
9.
business arising?
Yeah.
Okay, our CIO report.
Okay, so Bob is obviously away today. The revenues, expenditures, and community grants are on track after the second month of the fiscal year. Monthly revenues from PEI assessment are slightly higher than budgeted by $2,818 per month. And the negative balance for this month is due to the timeliness of the community grant payouts. So that should balance itself out shortly.
Which negative amount are we?
The 2,218, I think it's just due to some of the payouts that we had to make for some of the community grants recipients. I don't have that list in front of me at the moment,
that's
but yeah. Is that it?
Any,
That's it for me.
any idea where this extra from the province came?
Which
Did-
part?
The 2,000 per month or whatever it is, you said,
So it's slightly higher, no, I don't, I'm.
is that
not
in
sure.
our? in
It
the-
should be in here.
In the greater tax bracket or?
Yeah, the province just adjusted for the new rates,
Okay,
and it came
Thank
out
you.
a little bit higher.
okay,
At least that's my understanding from FPIM.
Okay.
It wasn't the big payout that we were hoping for.
No.
We're still in negotiation for that.
right. But that's where that came from, is
Yeah.
they adjusted their
But
rate.
yeah, it was just the like yearly adjustment.
Okay, thank you,
Yeah.
Catherine.
All right. Thank you, Catherine. So the official community plan and development bylaw, item 10. RMB are now in discussions with FOTEN about a timeline and process to start up again. RMB is coordinating dates between council and FOTEN and lands for a suitable meeting and public meeting dates. Currently looking like the mid to late September range. This has now been confirmed. This meeting will take place with lands and council on September 18th as part of their regular council meeting. This will be done in camera post the regular council meeting. So after our council meeting, we will go into camera to discuss with lands our development plan and, our community plan and development bylaw. Okay? The process, FOTEN has revised the draft documents based on the comments heard from the public and council in 2022, which are now on the RMB website for further public review. RMB is having a local island development officer review the drafts and provide comments. Council will have a process clarification meeting with lands, which again is September 18th. Then council will resume public discussions, and that public discussion meeting has been set for September 25th, and that will be with FOTEN. I am not sure if they will be here in person or whether this will be virtual. We are still we're still waiting to clarify what they want to do there. So mark those dates.
The second, what's the last one?
The 25th of September is going to be the public meeting, which I will be posting to our Facebook page and website to give everybody adequate notice so that they can attend. And the lands meeting will be, again, part of the council meeting, but will go in camera, so that will not be open to the public, and that will be on September 18th. And that is all I have for item 10.
I've got some things about that. So I've asked on a number of occasions, what bylaws are proposed that are beyond what's outlined in provincial legislation? And I asked that this be reviewed by the property development officer that's been hired to identify what those are. And that's an important question, and I'll tell you why it is, because my question about that is, should the municipality be burdened with the cost of enforcing provincial acts, which are the Provincial Planning Act, the Environmental Protection Act, and the Land Protection Act, which would be incorporated into any official plan? So if that happens, then if an applicant appeals a decision to IRAC, why should the municipality be responsible for the cost of hiring a lawyer to defend a decision that was made in compliance with the Provincial Planning Act? I kind of feel that unless there's more restricted, that we should not be responsible for administering those three acts for the province, which is really what is happening here. The cost of it being downloaded on the municipality under the guise that we now have control of development in our municipality, but we do not have it because we are forced to follow the Provincial Planning Act. And we cannot override it. All we can do is make it more restrictive. So I think I can see where we would be responsible for defending the rejection of a building permit or any kind of development permit that was based on bylaws that we made that are outside and beyond what is done, what we're mandated to follow by the province. And that's an important question, and I'd like to see what those proposed bylaws are. Because I attended some meetings earlier on, and I didn't hear one bylaw proposed that made any sense to me at all.
I don't have an answer
No,
for you.
but I requested that
Okay.
that be pulled aside from the provincial act, and I would like to know what they are.
Okay.
These are great questions. Anybody else? Okay.
Okay,
Catherine.
annexation exercise.
So the annexation subcommittee last met on May 1st. And during that meeting, we discussed basically what the next steps were for us. So we discussed funding for the exercise. We created our list of which communities would be involved, and those have been circulated tonight. And we also discussed, since FOTAN is already doing our official plan and development bylaws, what the parameters would be with them to incorporate this directly into it, and how much that would cost potentially. And we also made the decision that we would run this parallel with our community plan. So that being said, we haven't had a meeting since May. Our next meeting is going to be July 3rd. That is open to the public, so anyone is welcome to attend. It'll be in the RMB office at 7 p.m. And yeah, we're just going to continue the steps.
Thank you, Catherine.
Is there any kind of procedure that the government has laid out that has to be followed?
Yeah, the Municipal Government Act.
So
And it says that we just.
Are we back to item 10?
And it
Sorry.
says that that means what? That we have to ask these people if they get to vote on it? That we just say, do we annex them like Russia annexed the Crimea? Or do they have an opportunity to react to this?
yes, they do, and we've discussed that several times. So there was the steps. I believe they were emailed out previously. But yes, there's a whole list of things that need to happen prior to us moving forward with anything. And we've made it incredibly clear that we won't be going forward with any community that does not want to be going forward with us. So nobody will be forced into anything from all sides.
If I recall right, I believe that in Lower Montague and surrounding municipalities, surrounding areas in Montague, they had a vote and it was overwhelmingly rejected by all of these communities around Three Rivers. And then the province came in and said, I'm sorry, but you have no choice. Is that correct or not?
Well, and that's their municipality. What we have said in this exercise is that we will not be doing that. If you remember back a year ago when we started this process, the entire purpose was because we heard that the province was going to be forcing us, that we didn't want to be forced. So yes, the province ultimately has final say on anything. They can make us combine with Murray River tomorrow if they want. But as far as the exercise that we are performing as a subcommittee, no, we will not be forcing anyone.
Okay.
Shop Belfast PEI update. Ashley Pestro.
All right. So, Shop Belfast is rolling along nicely. So far, I was able to make promotional clips for our big launch, Belfast Tulips. I also did a promotional video for them, Broken Rock Fossil Shop, and Island Pride Garden Company. My plan in the next few weeks is to make more of these to help promote local businesses. And I am going to be on site at the Belfast Lavender Labyrinth on Saturday, June 29th at 2 o'clock to help them promote what's going on there. It sounds very exciting. So I hope to see you all
Grand
there.
opening, is it?
It's their grand opening. Sounds like it's going to be lovely. So I'm looking forward to that, and I will post more information to our Facebook page as it becomes available. All right.
Municipal Emergency Management Plan, MEMP.
Okay, so all of you got a flyer for the Municipal Emergency Management Plan Hazard Risk Assessment meeting, which is scheduled for Wednesday, June 26th at 7 p.m. It's going to be here, and I have several organizations confirmed to attend. So it looks like this meeting is going to be going forward as planned, and hopefully we will have some great discussions come out of it to help the community prepare for different events that may come up. So there we go.
Thank you, Ashley. New business for the agenda. Selkirk Road concerns, update from Lynn Doherty.
All right, so the ongoing concerns of the Selkirk Road and the speed concerns. I met with Michael Stewart on May 27th, and he is one of the engineering assistants with the province, so he does audits for roads, and he follows up on concerns of all our highways. So we had a really good kind of back and forth conversation while we were there. We started at the Orwell end, and he allowed me to show him the areas where he wanted to take photos and get an idea of how narrow the road was. And we went all the way down to the junction of Iona, and He did note the flashing lights. He noted the difference in the stop signs from one intersection to the next. He said he was going to look into when that changed. He has
It was
to
30
do
years ago.
Yeah, so I'm assuming it has something to do about the store that was on the Iona corner. I think that's why it was so close to the corner. But he's going to begin a speed audit. He's going to put the measurement strips out. This doesn't happen overnight. It takes time. He's got to do like counts, traffic counts. He did note the narrowness of the road as it approached those intersections. You could visibly see where the pavement goes in, and the white paint, like, it's kind of like a teaser to make it look like the road's narrower than it is, probably to slow people down. So he has a plan. There's new LED stop signs that glow in the dark. There's the white paint he suggested, painting the shoulder of the road to have the illusion of making the road seem more narrow. And then he's going to process some signage. Putting up a 40, 50, or 60 sign isn't going to help. It's not going to slow people down. And essentially having someone giving out speeding tickets every day will eventually wear off as well. So that's where he's at. He's going to begin his audit, get his team from the province to go out and kind of calculate A, B, and C and what will work best for that area. And he will keep me in the loop. They've got other stuff on their plate right now with
I bet.
other. There's other roads on the island that are not necessarily that Selkirk is a priority, but they kind of one thing at a time.
Yeah.
And triaging what's the most serious. So he will keep me in the loop when they are going to be back out in the area, and I will give an update. I think it's quite a positive thing that they've reacted so quickly
Sure.
to this area, and that they already have a plan. It's just they have to complete it, and he promised he will keep me in the loop
Very
as to
good.
what their next steps are.
Well done.
Yeah, thanks.
Belfast Days. Take a breath.
So Belfast Days is this weekend, June 21st to 23rd, and I want everyone to cross their fingers and toes that the weather continues to stay good for this. I think there's a lot of built-up anticipation this year. I'm feeling it. I know there's a lot of work gone into this event this year. I have an amazing team of volunteers with me. It's not just me. We have added a lot of things this year, and I think that's what's enticing us. There's just more to do and more time frame. There's not a limited, you can just come from 2 to 4. There's a really wide range of times that the activities are happening, so it kind of helps people plan out their day and when they can come enjoy the activities. So I did bring a printed copy of our agenda, and it is on the Facebook page, Belfast Days 2024. It has a list of everything that's happening, subject to change, of course. But it does explain the location is at the Pennant Raceway. It explains the times. So Friday night, it's our drive-in movie night. Gates open at 7:30. Saturday, gates open at 2. The parade begins at 3 o'clock. And activities are continuing throughout the day, right up until 10 p.m., where there's going to be an amazing fireworks show literally over our heads. I'm really excited about this. This is a company from Halifax, and they do shows all over North America. They're Fireworks FX, and they put on a great show anywhere they go. I've checked into their website as well.
Are they going to fly the fire index the way it is right now?
Yeah, they're keeping in contact with the fire marshal. That's
Good.
This company deals, like, I didn't have to do anything,
Right.
and that's what's really great. This company does all the permitting and all the contacts and the documentation and everything. So they're in contact with our PPI fire marshal. So they're keeping me in the loop on that. But so far so good. We have had some rain, so I think that did help. But Sunday is also a big day too. I'm really trying to promote our local harness racing. I'm not sure how many people know we have a harness racing track in our area, but I'm really trying to keep it alive in this community and promote it. And again, as always, we are doing this event in support of Make-A-Wish. So it is my goal to raise enough money this weekend to at least grant one child's wish on PEI this year. We're getting amazing kind of boosts on social media. I see PEI Community Navigators has us as their number one stop for their events for this summer.
Oh, yeah.
So they're boosting us on their itinerary for the summer, which is nice. Great shout outs from the Eastern Graphic.
Yes.
Amazing article, like just blew me away today when
You
I
have
saw
a
that
representative
article.
here right now that can give us a shout
Like,
out.
congratulations to the Eastern Graphic for going way out of their way to make this story and promote what we want to share and showing our initiatives and why we're doing this, and the photo and the colors and just telling my story of where this came from and why we want to keep it going. Like, thank you so much for doing this great segue into the weekend for us. And I think that's kind of says for itself. Everyone has access to the agenda, and I hope everyone comes out. I really want to see all the familiar faces there and support Make-A-Wish. We're going to have their staff there this weekend accepting with us. They're going to be in their t-shirts. They're going to be accepting the donations.
Who is their ambassador this year?
Our
Is
ambassador
that allowed
this
to
year.
be announced yet?
Yep. We have, she's 10 years old. It's Siriana De Sosa. So she's local.
Okay.
And we're very happy to have her represent Belfast this year. So she's going to be there the whole weekend. She's going to be handing out prizes. She's going to be in the parade. She's going to do our final horse race presentation as well. So we're quite proud to have a local little girl
Yeah.
join the event.
And what movie are you going to be
Our movie on
screening?
Friday night is Night at the Museum. So I'm super excited for this. I loved it myself. And it's a safe family movie. It's rated PG-13. It's great for any age group. And I mean, it's free admission, drive-in style, lots of local vendors. And our vendors are new to the community as well. Like, one other thing I want to add is the Belfast Roadhouse and Lounge is going to be at Belfast Days with their food. So this is an opportunity for them to kind of do a soft opening out in the public, and the Sweet Company and Iona Sweets and Bar Vela. Like, I'm just all about bringing all these local businesses to our community and having them join us at Belfast Days. See you all there.
Very good. Thank you.
Yeah.
Community pantry update, Catherine.
So essentially it's the same as the last meeting. Unfortunately, there's increased uptake. So exactly what we kind of expected. We were hopeful that, with summer and hopefully more employment, that we would see a reduction in the use, but it's only continuing to increase. But our coordinator said that thankfully the community is keeping up with the increase, so that's really great. She's also applied and tentatively been accepted for a new grant as well, so things are as good as they can be. But yeah, thank you again to everyone who continues to support it, both financially and by donations.
Okay, thank you, Catherine. FPEIM update.
So we just last week we're finally able to get the red tape from the province to introduce the Municipal Infrastructure Fund. That was a huge effort through the FBIM. It took a very long time to get everything situated. The unfortunate news is that RMB isn't applicable for it. It's for rural municipalities, but only those who have sewage. So unfortunately, we can't access it, but there are many others across the island that will be. We're also anticipating this summer that the State of the Island report will be released. And so pending what that brings, there could be a whole lot of work. We're preparing for our annual meeting with Minister Rob Lance in the fall. And so we're just in the process of coming up with our agenda for that. I think what's most pertinent to RMB is that we will be addressing and asking for those incentives for restructuring that were verbally promised. So hopefully we'll have some news on that. From the President's report, FPIM has hired a new communications assistant for the summer. The Fostering Resilience program is continuing on to its second season, and they had their first session a couple of weeks ago. And as always, this program is open to all counselors and CAOs who identify as women or female. And I guess the final thing is last month I was elected in as the Vice President of Rural Municipalities.
Yeah, congratulations.
So that's everything this year's ever.
I noticed on the thing you got sent around that the link to the official plan update doesn't work. And I couldn't find anything on the provincial.
So you checked on the website?
So
I couldn't find it, I searched for it, I couldn't find it.
Our website, yeah, okay.
It says that there's an official plan update. And I couldn't seem to locate that.
Is this specific to our municipality or the FPIM?
I think it's, well, I'm really not sure all it does, it just says the land use official plan update.
Sounds like FPIM.
Yes, it does.
okay,
And
I'll email.
I couldn't locate it, and the link doesn't work.
Okay, I'll try to figure it out. I'll message you after to get that sorted.
Do I keep going, Catherine?
Sure. June, I did this last June as well. Just an acknowledgement that it's the beginning of Pride season on PEI. So, yeah, just happy Pride to all those who celebrate. The final thing for me is Polly Park. So, I had a constituent reach out to me last week, I think it was, the week before, with concerns just about the park's use or just the appearance of it, because it's not being upkept.
This is the one just by the.
Yeah, so this is the one right by the Belfast Church, just kind of that island there. So there was a lot of confusion as to who's responsible for it, who owns it. So I did reach out to the province, the Department of Highways, seeing if they would go out and mow it. And through that, we found out that it's actually privately owned. It's kind of strange.
I saw somebody mowing it in the last few days.
Okay.
Yeah, it has been mowed
Okay.
somewhat.
Okay. So the ask to RMB was that we would fund or facilitate mowing, but through finding out that it was publicly or privately owned, I was advised that we couldn't do that. So that's good news that it has been since mowed. I think this individual reached out to quite a few organizations, so obviously someone has picked it up. But that was just my update on it, that we were continuing to look into it to see if there was some resolve, but looks like it might have already been resolved, so that's great.
Well, not really. It looks worse than it did, but,
The thought that came
well,
on.
yeah, you take long grass and mulch it,
Yeah.
you know what you're gonna get.
And is it all over the road? I haven't-
No,
It's
no,
not like a mess?
no,
Okay.
it's just
Just
a
in
field
its
of-
own little area?
Yeah.
Looks like my front yard.
Too fast and one don't blade by the looks of it.
But, yeah, different ones have been after me most of the spring and some of the winter to, look into that. There was some organizations thought council had been paying for that for past, but not since I've been part of council, we haven't. So, and it is, you're right, I did find out it's private property.
Yeah, privately owned, and actually the woman who owned it has now deceased. So it's kind of a whole can of worms.
Well, yeah,
Lawyers would
and-
have to be involved.
And the church
get
is
transferred.
after keeping it nice for the 200 thing, then, but they don't want to
Yeah.
cut the grass. So I don't know.
Okay.
Thanks anyway. Okay, our next meeting.
No,
of
I
the-
have a.
Oh, I'm
I have
sorry.
One last thing. I'll be
Excuse me,
very-
I'm sorry, CAO.
No, I'm not. I just have one last thing very quickly. So Crimson Clay will be performing at Musicabilia this year from 11 to 3. This is Saturday, July 20th. This is the second year we've ran Musicabilia. This is a Wood Islands Area and Area Development Corporation project. So this is the first time having live music, so come and check it out. There will be a barbecue, and there'll also be a music sale, so CDs, vinyl, tapes, like music t-shirts, books, everything. This event was packed last year. It was very busy and very successful, and we hope that having the element of live music will draw even more people out to enjoy this beautiful area. That's it. That's all I got. You're done.
Okay, our next MEMP Hazard Risk Assessment meeting has been previously announced as June 26th, 2024 at 7 p.m. here at the Wood Islands Market Hall upstairs. Our ASC committee meeting is July 3rd, 2024 at 7 p.m. RMB office, Wood Islands Market. No regular council meeting for July. Resumption of RMB as official plan and development bylaws discussions will be announced for September 18th or 25th,
Okay, so the
or just to be announced.
no, so there'll be the meeting with Lands is going to be in camera after your council meeting in September on the 18th. And the public meeting in regards to the community plan and development bylaw will be on the 25th of September, and I will be giving everybody lots of notice, so stay tuned for that.
Okay.
Is that at regular time? 7 o'clock?
7 o'clock. As far as I know at this point.
Yeah.
Okay.
Okay, is there any other business? Okay, as there is no further business, we turn the meeting over to Billy.
Move to adjourn.